My name's Rick Hershberger. I'm a vascular surgeon in Sarasota, Florida, and I'd like to welcome you to Whiteboard Wednesday. Today I'm going to discuss arterial blockages in the legs and how they affect the circulation, and more importantly, how we can treat those blockages to help patient with symptoms. What I've drawn here is a simple diagram of the blood flow. It comes down what's called the aorta. At the belly button, which is right about here, the arteries divide to go to either legs, go down the groin. At the knee, these arteries divide into 3 separate arteries to go to the foot. Blockages at anywhere along these course can cause issues with the circulation to the leg. One of the common places is in the femoral artery in the thigh. What typically happens is a patient solely develops a blockage. You have another artery that comes off in the groin and can actually work around that blockage with what we call collateral flow. However, in some patients, this blockage is significant enough that the collateral flow does not develop to the point that it can actually bring adequate blood flow specifically to your calf muscle. With this limitation in flow, patients have problems walking distances, and in most extreme cases can only walk a block or so before they have extreme discomfort in the calf muscles, have to stop and rest. And so in these cases, we can do a procedure where we get a wire to go through this blockage and open up the blockage with a stent. Now the blood flow goes through the area that was previously blocked, a wide tunnel which is much more effective at delivering blood than all of the collateral flow that has already developed. And in this way, we have more blood flow to the muscle, and in turn, you no longer have symptoms with issues walking long distance. There can be more complex where it's at multiple levels to include what we talked about, the femoral artery, the artery behind the knee, the popliteal artery, and even the tibial vessels, which are these smaller vessels in the calf. If you have combined blockages, your problems can be more extreme. We have pain in the foot at night, or even wounds to the foot that aren't healing because of the lack of circulation from all of these blockages with inadequate collateral flow. Once again, we can perform procedures to balloon or stent these blockages, or in some cases perform bypasses to bring more blood flow to the foot and save the foot in those more compromised situations. So in this way, we can treat the blockages, improve the circulation, and your own circulation is way better than the collateral, so it relieves your symptoms. Once again, my name is Rick Hershberger. I'm a vascular surgeon in Sarasota, Florida, and this is our Whiteboard Wednesday.